And welcome to today's session, which is the third live interactive session of the Research Data Management course. Today, we are joined by a senior qualitative researcher from TGI who will be taking today's session on research data management in qualitative studies. So, Dr. YK Sandhya is a senior research fellow, mental health at TGI, and is based out of her Delhi office. Sandhya has received her doctoral degree in social medicine community health from the prestigious Jawaharlal Nehru University in Delhi. Her work with TGI's mental health program involves assessing the effectiveness of technology enabled delivery of mental health care by primary healthcare workers for depression, suicide, and stress among adolescents in urban slum communities in Delhi and Vijayawada. Sandhya has a rich experience of working with marginalized communities and of co-production with them. Her research interests includes developing gendered understanding analysis of mental health issues in India. And since she has such rich experience in qualitative research, she would be the perfect person to answer all your queries related to qualitative data management and qualitative studies. So without further ado, I will hand it over to Sandhya. A very warm welcome, Sandhya, to today's session. Over to you.
Thank you very much, Akansha. So I shall start with the presentation. I will try and keep it brief so that if there are any questions, we can take that on. Qualitative data management and quantitative data management essentially is about data and how you manage the data. So you will see as we go through the presentation that there will be a lot of commonalities in the way in which, the steps that you take while you are doing data management for qualitative data. Now, the first thing, which is absolutely important, something which even Nivedita reinforced several times, is that you really need to plan. And you need to make this plan as early as possible. So you cannot, wait just before you're going to do data collection and say, okay, let's make the plan. No, the plan has to start even when you're thinking of writing the proposal. Ideally, include it in the proposal. And what is it that you have to plan for? So there are several things. I've broken it down into 10 different major heads. The first is, who are the personnel who are going to be working with you on this project for data collection, qualitative data collection I'm talking about, not the whole lot of staff who would probably be contributing to the project. So you would, for example, think that, okay, the PI will be involved in qualitative data collection. Besides the PI, we want to have a team of research assistants, associates, research fellows, and there will be, say, 2, 3, and all of them will be involved in conducting, say, in-depth interviews. I'm just giving an example. They might be doing stuff to collect the data. So if this is the case, then when you are planning, you have to think about the language that you will be using for the interview. Is it going to be in Hindi because it's, say, in the north? Or is it going to be, let's say, Telugu because it's in the south? Or maybe it's Bangla, you're doing it in Bangladesh, So that clarity needs to be there. Who are your research respondents? What is the language that they speak? And given that, does your PI and the other members of your team who are going to be collecting the data, do they really know that language? If they know it, then it's fine. If they don't, then you will have to plan to have, strategies to address this. So do you hire an additional person who will help with translation? How exactly do you go about this? Now, the second thing is you would also have to keep in mind the practices and procedures that you will use to collect data. So Surekha has already done this with you. She's talked about many kinds of methods that you can use for data collection. So I'm just going to talk about 2 very briefly. So one is participatory research. So when you are actually engaging the community who you are going to study. So in a way, the community are your study partners, your research partners. And they are playing a very intimate role in identifying what issues or what questions should be studied. They're also helping with data gathering. So in such a situation where, the respondents are part of your research process and they're actually contributing to it, the presence of the researcher is not intrusive because, everyone is part of gathering data. So the methods that you will use to gather that data will be, maybe you can do, for example, say facility audit, using qualitative tools. So that is one. But suppose your method is you're thinking of doing participant observation or you're thinking of doing ethnography where you haven't you're not involving the study participants as partners in your research, then in that case, the way in which you collect the data will have to be more subtle. It can't be, open. So it might be something that you observe and then later go back and write notes about it. So that is also something that should come on really early when you're planning the process. The third thing is that what is the media or the formats in which you will collect the data? So will you be doing a recording, in which case it will be an audio file? Will you be using archival data documents? So then you might have to scan it and it might be in the PDF form. Are you going to be using photographs as your data, in which case it will be a JPG form, and so on and so forth. So this is very important. You must have clarity on this, because then you will be able to plan how you will need to store this data. Because when we go lower down, we could see about this. And then you should also have a fair idea of what quantity of data are you expecting to collect. This is important because, say you thought that, okay, we will have around 2,000 video clips. So you will think, okay, 2,000 video clips can be accommodated in a storage space of, say, X. And then when you actually go to the field, you have collected, say, not 2,000, but maybe 20,000. So obviously the data storage equipment that you thought of will not be able to accommodate that. So you need to have some approximate idea of how much you will be collecting. It doesn't need to be exact, because the device that you choose should be able to accommodate twice or even thrice the amount that you're planning, but not more than that, because otherwise you will have issue of storage and where do you keep this data. Then the fifth thing is really about how you organize your data. So this is important because all data that you're collecting, they must be stored in separate folders that are properly labeled. And there should be a specific naming convention that you follow. It could be something that you devise for yourself and your team, that's fine. But there should be a logic in the whole flow, the way you're doing it. So that anyone who's seeing the data, say we leave the project halfway through, or say somebody else joins us later, then they are able to understand the logic of the way in which this data was stored. And as you're doing reiterations in the data, there might be new versions that come up. So it's important to also label your documents such that you're able to identify which is the latest version, so that there is no confusion when you're actually using the data. So I'm going to give you some examples for naming convention. I'm hoping you can see this image which is there. So basically this example will show you how systematically they have organized their data. So they've kept data, so they have different kinds. You can see audio tapes, transcriptions, there are photographs, there's stimulation material, basically the material that you're using to trigger a discussion among participants. Suppose, say, you're using photo elicitation as a technique, then you will be using a photograph to start off the discussion with them. So all of these are clearly labeled in separate folders. And the way, if you see the naming convention, the way in which this has been done is they've taken the date. So on a particular date, which in this case is, let's say, the 22nd of January 2013. So that is clearly mentioned. Then you will also write, see, they have written audio. If you can see towards the end of the name, there is audio or trans or photo written there, and images also written. So this clearly tells you what kind of data is this. Is this an audio recording? Is it a transcription? Is it a photograph? So this helps you very clearly to identify the data. Ideally, if you have a recording and you've given it a certain name, use the same name for the transcription related to that recording. So if you can see here, that's very clearly done. So you see this, the first one is interview 1 F38 Manchester audio, okay, the first one. And the same thing, if you come to transcription, it's the same thing. It's interview 1 F38 Manchester trans, which means it's a transcription of that particular audio recording. So if you do it in this way, it's pretty easy to identify the data, and it's also easy to retrieve when you need it. The next is, how do you process and transform data? So you remember Nivedita had talked about raw data being actually taking a journey, and moving and being transformed in the process. So you're processing data before you go into analysis. there are various steps that we use when we process data and qualitative data. I'm giving you two examples. The first example is around anonymization, which is very critical. So how do you anonymize the interview transcript? So for example, if you, so you must give a unique, ID. And as I told you earlier, you can create this yourself, okay? But it should have a logic. So suppose, for example, DL underscore FGD1 underscore W denotes the first FGD that you have conducted with women in Delhi. If I'm going to follow this logic, what will I name the second FGD that I'm conducting with women in Delhi? Anyone, please unmute. I can't see the chat, so I'd prefer that you unmute and tell me. What should I name the second FGD that I'm going to do in Delhi with women?
It would be DL FGD2W.
Yeah, almost correct. Can anyone add to what Usha has said? She said DL FGD2W. Does anyone want to take a shot at refining this further?
It will be DL underscore FGD2 underscore W.
That's correct. This is what it's going to be. So when you do the naming, as I said, please follow the logic as closely as possible. So Usha, the underscore here is also very important. Okay?
Yes.
So you follow the same convention throughout. All right?
Yes.
Okay. Now, the second thing that you would do in qualitative data, and I'm certain you will hear more about this in sessions that Surekha takes, but I'll just give you an example, is coding of data. Now, why do we code the data? So coding actually helps you to organize the qualitative data that you have collected so that it becomes easier to see patterns in that data, and you're able to analyze that data in a structured way. I will go follow this up with an example. So I'm hoping again that you can see this image. I've given the references. By the way, towards the end of the presentation, I have all the references that I have used. So you can easily go to these places and read more about it. So if you will see on the extreme left, there are the quotes. There's a thematic description. And then after that, there is an analysis, the analytical theme that you will draw out of this. So the quote, for example, so when you're reading, an FGD or an interview, you see some things that seem to relate with the fact that very few men, they attend the second and fourth visit. We are talking about ANC visits, okay? And then many men attend the first antenatal visit. And they usually attend it together. When pregnancy is in the early stages, they go with their wives. So suppose this is what you have come out when you're reading the data. These are the things you have identified out. So then the thematic description of this basically is what is men's attendance with their wives for maternity antenatal care services. And then the analytic theme that we draw out from this is that men are involved. To an extent, these indicate the fact that either men are involved or they are not involved in maternity care with their wives. Okay, so I would recommend that you really read this article because there are a lot of examples given here of how they did the analysis. It is not about data management. It's an article where they are presenting their findings. But I found this way of coding, the way they have shown the coding, quite easy to understand to people. So the main bottom line in creating codes is that you need to read and reread your data several times. And if you are working with a team, each of you should read and reread it independently and then come up with your own codes. After which you come together, have a discussion, and then finalize the set of codes that you think the data is throwing up. And then you start cutting, pasting, putting all your data into these codes. Now, NVivo, for example, is a software which will help you do that. It will help you, automate the coding, but it is not going to help you with the analysis. So the analysis finally has to be done by the researcher. No program, no, software is going to do that for you in qualitative data. It will only assist in making coding easier, in putting things into codes, and then generating, this is the data that is under the first score. But what you're going to draw out of this, how you're going to analyze it, all depends upon the research team. Therefore, immersion in data, reading the data several times is extremely important. I can't stress the importance of this, And I was talking about anonymization of interview transcripts. So this is very important. As you saw in the naming convention, transcripts of each interviews should be saved in separate files. And ideally, you should give background information in the beginning of each transcription. So you know exactly, who the person is. So you give the interview date, who's the person who interviewed, so the interviewer, the researcher, who's the person who you were talking with. That is something that you should mention. Better to use a pseudonym because you want to anonymize. So at this stage, you should already be using a pseudonym, which is not the real name of a participant, but some name that you give. It can also be a code that you want to assign. That's up to you. And then you can give a brief of the occupation of the person, the age, the gender, and so on and so forth. Another thing that many of us do when we are doing these kind of transcriptions is that if you have, let's say, an FGD, okay? Now, in an FGD, you have many participants. So you might not be able to write down all of this information at the start of the transcript. In which case, when you're conducting the FGD itself, you would have a registration sheet where, make them sign on to it. Consent is a separate thing. I'm talking about the registration sheet. In that, you could already have brief socio-economic profiles that you would like to gather. So you can have, instead of just the date and the name and the signature, you can add occupation, gender, stuff like that, so that information for that particular FGD is already captured with you somewhere. And then you can type it out and keep it along with the FGD transcription and the transcription as well as the audio record, because it becomes a little difficult in an FGD to identify who the speakers are. Not required also, but just in case you want to know who are the participants, it's good to keep it separately and do it while you are just before you conduct the FGD or maybe just after it. So make sure you collect that information. Move on. So why do we anonymize data? And why is it important in the first place? It's important because it's our duty to actually protect our research participants, and you must absolutely keep this in mind. So any data which is sensitive, any data which involves personal identifiers like sexual orientation, perhaps, or illness status, all of this must be removed. And if you're sharing your audio recording with somebody who's transcripting it for you, it's not being done in-house, then it is essential that you sign non-disclosure agreements with them before you transfer the data to them, and encrypt files before you transfer, so that there is no question of it being misused. For videos and photographs, if you cannot record the background information, sometimes when you take a video, you can actually speak a little bit, talk about the background information, and then do the recording. But in case it's not possible, then you should also have text, which gives details of who's the person who took the photograph, what was the date when it was taken or made, where was it taken, who's the person we are taking the photograph of, to the subject, what is the photograph about or the image about. And in case you're using some other image that somebody else has taken, then copyright should be checked to make sure that you are giving credits adequately. If you're using articles which are online in a journal or a magazine, then make a separate file for them. And it is always better to actually copy this article into, a document rather than just saving the URL, because many a times after if you revisit that particular URL and click on it, you get this message of, 404 or something like that, file not found. So you want to avoid situations like that. And therefore, you should really copy paste these and keep copies separately with you, so that in case the URL is not working, you still have a record. And any article that is referred to, needless to say, you are all aware of this, we have to reference it properly. So all the bibliographic information related to it should be properly saved with details of the author, the title, the publication, date, volume number, and so on and so forth. Now I'll move on to data security. I'm not going to talk too much in detail about this because, as you can see, this is going to be covered by Vijini in module 5. But generally, you must think about security and integrity. So how are you going to ensure that the data you're collecting is secure? Now, an example of this can be that you have notes that you've taken. So remember, Surekha said field notes are critical, that you should be taking those notes. So you can keep those notes, for example, in a locked location. And you can keep information in such a way that nobody can identify who the respondent is. You can type your notes and keep it in an encrypted file. And you must consider who will have access to this data. So decide early on, is it going to be only the PI? Is it going to be the PI plus the qualitative researcher? Or do you have a team that is going to be doing the analysis? In which case, they should all have access to the data. So you need to decide this before. So it's not necessary that the team that is collecting the data is doing the analysis. That's not essential. So data collection is separate. People who are doing the analysis might be different. In which case, who gets access to it is clear. It's the people who are really analyzing the data who are the ones who should have access to it. Nobody else beyond that team should. And so then you have to think, how will you prevent people from gaining unauthorized access? You know, what will you do to prevent them from altering the data, from changing it? So you might, for example, password protect your documents. You might change it into a PDF so that no one can tamper with it. So there are various ways that you have to think about so that no one can really change what you have in the written or typed format. Okay, so data storage and backup, you also need to plan how you will store the data, how you're going to back it up. Now, there are various devices that are available to help you with this. So, for example, you can store it in a portable device. You can put it into an external hard drive or a pen drive. You can use a cloud. So, there are many clouds. For example, you can use OneDrive, Dropbox, or Google Drive, you know, or your organization has a cloud system. Or you can have it in your own computer, in your internal hard drive. There could also be networked drives. So there are various places in which data can be stored and backed up. Now, all of them have some advantages, they have some disadvantages, and you must take precautions if you are using one over the other. So the advantage if you're using a portable device, since it's portable, obviously it's pretty easy to transport and you don't need internet. So it's very, very useful in a field situation, you know, where you don't have internet and you can't carry anything bulky. It's also a low cost option, but there are disadvantages. So one is that a pen drive is small. It's easy to lose, you know, it can be stolen. So there's a security risk to all the data which is in that. It's also not good for long-term storage, and it's certainly not good to store any master copies that you have of your data, because these can get spoiled, or as I said, they can get lost. And there can also be a possibility of a lot of version control issues, you know. So quality can get compromised if you are not storing everything with different version names, as I mentioned earlier on. It should be done, but if it's not done, then that could create an issue. So if at all you're using this, the precaution that you should try to take is that you use it with encryption and extremely strong password protection, so that even if it is lost, your data is going to get lost, but no one else can misuse it. It becomes that much more difficult for them to access the data. Suppose you're using the cloud and you're deciding you will store your data, say, in a Dropbox. Now, the advantage of this is that it automatically backs it up, and it also automatically helps with version control. But there are several disadvantages. First of all, not all cloud services are secure. You know, many of them actually might be unsuitable, especially if the data you're collecting is sensitive and if it has personal identifiers. And sometimes you don't have control over, you know, where that data is stored, how often it is backed up. If you're giving it to some commercial data storage people, then, you know, they might use it for their own purposes. Say they use the data for marketing. So, or if you lose your, you know, your account is lost, or it's suspended or it's deleted, then all the data related to that account will get lost. So nonetheless, if you decide to use it, you must ensure, again, I'm repeating this, that all personal data has to be encrypted before you upload it into the cloud. And you should very carefully read the terms of service. Those will be microscopic, usually the font, but take the trouble to read it, because it specifies the rights of the service provider to use that content. And make sure you are not giving them rights to use it for their own purposes. So that's very important if you're going for commercial provider of storage space in the cloud. Now, let's say you're using network devices. So the advantage of this really is that the data is centrally stored. You can share access with other people in your team. You can access it anywhere you go. Remote access is possible, assuming you have internet. And backups can also be centrally managed, and they can be automated. So that takes care of the safety angle. But the disadvantage in this is that it has very high security precautions that are needed to prevent unauthorized access and to prevent accidental deletion. And it's nearly impossible to share this with any external project partners. It's pretty expensive also. So if you're using this to store your data, then the precaution that you should take is that you should use a combination of a suitably secure strategy to protect your data against anyone who's not authorized to use it. So the long and short of all this is that when you're storing data and you're backing it up, make sure that you have at least 3 backup copies, preferably in 2 separate types of storage devices. So don't store all your data in 2 separate pen drives. Better than that is one could be in a pen drive, one could be in the cloud, say, for example, or one could be in your hard disk, computer hard disk, and one could be in the external hard device. So whatever you do, make sure that at least one of these are stored in an off-site location. This is important because suppose, let's say, something happens, say there's an accident or a fire or a burglary, and it's stolen from one location, then at least there's a possibility that it is safe somewhere else. And regularly check your hard disk devices to make sure that the data is still there. You should keep checking it and make sure that it's there and it's safe. So that was for short term, like while you're doing the project. Now, after the project is over, you still have to do something with the data. So what's the long-term storage strategy? So you have to plan and think what you're going to do with the data after the study is over. How long are you going to keep it and store it? The better way to do is that once your study is over, you archive the data. And this can either be in an institutional repository, or you can put it, you can publish it in a journal supplementary material. You can also put it in the data repository if it is not sensitive data. If it's sensitive, please do the needful in terms of removing personal identifiers and other sensitive things. If it's totally sensitive data, then do not store it in a data repository, keep it elsewhere. And requirements sometimes are guided by funders. So sometimes you have to store it for 10 years, sometimes 5 to 3 years is enough. So depending on those requirements, please plan how long you're supposed to store your data. Now you also have to finally dispose the data. So how are you going to dispose of securely data that is confidential, that is sensitive? Just deleting it, pressing the delete button on your computer or in an external device is not enough, because sometimes bits of that data remain. Even apparently a factory reset can leave portions of the data behind. So there are really just 2 options for securely disposing of data. One is you physically destroy it. So you destroy the medium of storage. So let's say you break up, suppose it's in a hard disk, you break that up. Or you use software that are meant to erase the data securely. So this is important. Once you finish your study and you finish storing it for however long it was needed, this should be done, and safe disposal of data should be ensured. Data sharing, again, I'm not going to focus too much on this because Sindhu will take a session on this in November. But nonetheless, when you are writing up and planning, you should already think of what will be your plans for sharing this data. So will you share this data with access, without access, in a qualitative data repository? How will you ensure that it is confidential? Make sure your data has no personal identifiers. So within the data, suppose let's say someone is scribbling about a hospital or a doctor, and they name them. So you have to make sure that you remove those references and replace it with something else, a pseudonym, a number, a letter, whatever, so that that cannot be misused, and people shouldn't know what someone else is saying about let's say a hospital, because maybe if it leaks, then that person would not be able to go back and be assured that they will get the care that they should if they've spoken against the doctor, for example. And if you're not sharing the data, you decide, no, this data is too sensitive and we can't share it, then that's fine. But you must have a justification of why you are not sharing. And then examine the data to see, can we share parts of it and not share the rest? Is that possible? So that is also something that you must plan well before you start data collection. So finally, the key takeaways for all of us is that you need to plan, and plan. That's why it is, data management is all about planning. The more you plan, the more detailed your planning is, the more possible it is that your data will, be safe and you will be able to use it in the way that you want. Keep the study design in mind so that you know how you are going to collect the data and what you're supposed to be doing with it. Keep the amount of data that you will be collecting in mind. So just related to this, there was a question on the forum that I think Usha raised, which was how much of data collection should you do in qualitative data? I haven't touched upon that, but I'll just mention that there is something called data saturation. So let's say I decided that I'm going to do 5 FGDs, and I'm going to talk about the main thing that I want to find out is children's experiences of going to school, suppose. So I finish 5 FGDs, and then after that, when I'm doing the 6th, I'm seeing that, the same answers are coming. There's nothing new that is coming up. That means you've reached saturation and you should stop. Saturation might also happen at data point number 4. So after 4 FGDs or 4 interviews, you found that the same thing is coming, nothing new is coming. So you stop data collection there. So in qualitative data, unlike quantitative data, you don't have this fixed number of participants from whom you have to go and collect data. So suppose it's a quantitative study and you say that, okay, your N is 250 and I'm going to try and reach all 250 and collect data from it. And you will do it in quantitative. But in qualitative, that is not the criteria. It really is data saturation. Are you getting new themes? If you are, you continue with data collection. If you aren't, you just stop, because that's enough of data that you have. Then again, I'm repeating, your responsibility is towards your respondents. And you have to ensure that respondents are protected. So no sensitive data, no personal identifiers should be leaked. Data security is critical, and store and back up your data in multiple locations so you do not lose it. Archive the data and securely dispose it once you have finished with it. And data sharing should be done keeping country laws and policies in mind. Some countries do not allow for certain types of data to be shared outside the country. So please make sure that you're well versed with the country laws and policies before you start sharing. So I have the list of references that you can go to and read up more. There's lots over there, more details, but I thought just presenting a snapshot would help, and maybe you can do a deep dive if you need to know something else. So I'm going to stop with that. I